Welcome back to Health Daily. Today is March 10, 2026, and we are looking at a massive day for medical innovation, featuring breakthroughs in autism research, heart health, and a potential major shift in how we approach Alzheimer's. List of headlines on screen. 1. Autism breakthrough, researchers identify the domino effect brain signal. 2. Heart valve study, 7-year data redefines low-risk treatment. 3. Childhood obesity, the silent parental stress driver. 4. AI at HAMSS 26, agentic AI takes over hospital workflows. 5. Quick hits, colorblindness and cancer, plus the fibermaxing trend. Story 1, Autism brain signal. Our top story today comes from molecular psychiatry, where researchers have discovered a specific molecular chain reaction in the brain that acts as a domino effect in some forms of autism. The team, led by neuroscientist Haitham Amal, investigated nitric oxide's interaction with a protein called TSC2. The discovery, nitric oxide chemically modifies S-nitrosylation, this protective brake protein, marking it for removal. The impact, with the brake on, the mTOR pathway goes into overdrive, disrupting brain cell communication. Why it matters, the study suggests that blocking this nitric oxide production could restore mTOR activity to healthier levels, offering a clear map for targeted, molecular treatments for autism spectrum disorder, ASD, specifically cases involving SHANK3 mutations. Story 2, Heart valve treatment, 7-year data. Next, a massive, long-term study published in the New England Journal of Medicine has provided 7-year data on transcatheter aortic valve replacement, TAVR. The study, researchers looked at low-risk patients with aortic stenosis, comparing TAVR, a minimally invasive procedure, against traditional surgery. The result, at 7 years, both treatment approaches showed excellent outcomes. Takeaway, this long-term data validates TAVR as a top-tier, durable option, giving clinicians more confidence in selecting minimally invasive methods for younger or lower-risk patients. Story 3, Parental stress and childhood obesity. A shocking new study from Yale, published in Pediatrics, is shifting the focus of childhood obesity from just the child's diet to the household environment. The findings, the study found that parental stress directly contributes to childhood obesity risk. The solution, when parents practiced mindfulness and stress management skills, their children showed significant improvements in healthy eating, says the study. Takeaway, researchers suggest that treating childhood obesity requires a family-centric approach that addresses parental mental health as a primary factor. Story 4, AI in Healthcare, HAMSS 26. We are covering the HIMSS 26 conference today, where agentic AI is the buzzword of the year. What is it? Moving beyond just chatbots, these AI agents take action, manage workflows, and interact with electronic health records, EHR. Key highlights. Stryker's Smart Hospital, a platform that connects sensors to reduce alarm fatigue. Autonomous Robots, VC launched a robot that navigates hospital corridors for bedside virtual rounds. Scribe 2.0, an AI-powered documentation tool already used in 240,000 plus visits, speeding up notes for doctors. Quick medical headlines. Colorblindness and cancer. Stanford researchers found that colorblindness may mask a life-threatening warning sign of bladder cancer in some patients. Fibermaxing, the new trend. Studies are confirming that fibermaxing, a conscious, massive increase in fiber intake, can transform gut health and improve immunity. Alzheimer's in rural America. A new 422,000 patient analysis shows a massive care gap for Alzheimer's patients in rural areas due to a lack of specialists. Safety excellence. Healthgrades named 438 hospitals that excel at preventing in-hospital injuries, noting that if all hospitals match them, 100,000 plus incidents could be avoided. Quick hits / around the world. Adolescent prediabetes / T2DM. Among U.S. adolescents aged 10 to 19 years, roughly 30% have prediabetes or type 2 diabetes, T2D, with boys accounting for 62% of cases. Abdominal adiposity, measured by waist-to-height ratio, emerged as the strongest independent predictor of prediabetes or T2D rather than BMI. Medscape. Crohn's disease. French researchers have identified a distinct circulating viral community in patients with Crohn's disease, CD, that may serve as a disease signature. The findings published in Gastroenterology challenge the long-held assumption that blood is sterile and suggest that alterations in the circulating virome may reflect intestinal barrier dysfunction in CD. If confirmed in larger cohorts, these results could open a new avenue for biomarker development in inflammatory bowel disease. Medscape. GLP-1 receptor agonists, RAs. Adults with type 2 diabetes, T2D, who initiated and continuously used GLP-1 receptor agonists, RAs, faced a modestly higher risk for new-onset depression over 2.5 years than those with continuous use of SGLT2 inhibitors or sulfonylureas, SU. Medscape. That's your medical news for March 10, 2026. A lot of focus on molecular-level understanding and AI-driven efficiency. Let me know in the comments, are you using AI for your health, or do you prefer the human touch?
Outro and CTA.
Which of these breakthroughs do you think will have the biggest impact? Let me know in the comments. Don't forget to like and subscribe for your regular dose of medical and management news. Stay healthy, and I'll see you in the next one. Disclaimer: the information must be verified before use and the creator, publisher and YouTube will not be liable for any negative consequences.